Everyone, it's Budget Bunny here. I'm just here with our little Pacific Parrotlet Ella. We're here to give you update number 3. Unfortunately, this update isn't going to be as happy as I had hoped when I originally told you about Ella's sickness. Ella did have a relapse on Monday night. She seemed to be doing really well while on medication. We figured we had finished treating the peritonitis, and then about a week later, which was Monday night, she had a relapse where she lost the ability again to use her feet for about half an hour, seemed really drowsy and out of it, and just not her normal Ella self. So when I called the vet, they had a few possibilities. First off, they said that extended treatment wouldn't help if it was a bacterial issue, because they said at this point we had treated the peritonitis more than long enough that it should be out of her, or it would be out of her system, and that the Baytril would have cleared it up. She said that most likely it was a difficulty laying another egg, but I was certain this wasn't the case. Ella hasn't been showing any nesting behaviors and has been doing her normal acrobats and flying around fine. And generally when such a small animal's got, you know, a giant egg in their lower abdomen, they have difficulties maintaining their balance until they've passed that egg. So basically at this point what our vet said was that we needed to look at the underlying reasons the peritonitis happened in the first place. Clearly the medication worked for the peritonitis, but since she was still exhibiting symptoms, there's something else going on. What we did end up doing was waiting almost 2 extra days. Basically I called Tuesday morning. They were solidly booked and Ella was back to being normal. So we didn't get in till yesterday evening, which was Wednesday night. This gave us enough time to kind of monitor, see if maybe it was an egg problem, and then determine what kind of course of action needed to be taken. However, of course, she wasn't exhibiting any nesting signs. So when we took her to the vets yesterday, the first thing they did was a physical. She still seems a little puffy in her tummy area, but nothing like before. Her heart is strong, her pupils dilated properly. Everything on the outside looks perfectly fine. So the next course of treatment that I had mentioned previously was doing blood work and something called an aspirate, where they actually extract fluid from her abdomen and send it out for a cytological analysis. I kept declining that test because I felt like it was too invasive for a 34-gram bird to go through, especially when she's clearly ill. I didn't really want to do blood work either on such a small animal. Just to give you an idea of how small, how little, like how insignificant 34 grams is, I weighed my iPhone. My iPhone weighs 4 times the weight that Ella does. So if that kind of gives you a better comparison of what I'm talking about when I say how small and fragile Ella is, 34 grams is nothing. So anyways, that's why I had kind of passed up those tests. They were there in case we needed them to do further on down the road, but it's why I kept denying those tests. So when speaking with this vet, it was actually really good. She told me that she recommended doing the blood work. It was the least invasive next step. She also agreed with me. She didn't think that the aspirate, although the other 2 vets were kind of pushing for it, she didn't agree that it was maybe the correct next step for Ella, because she's already ill and apparently it's quite a risky procedure, especially on such a small bird, that she thought, you know, we get pretty good idea of what's going on from the blood work anyways, so let's not put her through that. And I wasn't really willing to do that test anyways. I was very on the fence about it. The other thing she said was, from looking at the 3 previous x-rays we've done, that we could also pass on another x-ray. because the x-ray wasn't showing us anything abnormal as far as tumors or enlarged organs or anything like that. So she said that if we did an avian profile 1 blood test, this would test her kidney function, her liver function, as well as her white blood cell count, so we get a good idea if there's any infection going on, if it's kidney failure or fatty liver or liver disease. And if everything came back clear, then we could safely assume it's a neurological problem. So it was kind of good having a different avian vet this time. There are 3 at the clinic, and I have dealt with all 3 before, and they're all very experienced and very good. I just kind of felt like I was a little more on the same page as this vet I had last night. And she also said that she believes what was going on with Ella was neurological, because it almost sounded like she was experiencing a series of strokes where she's losing her circulation in her feet. She can't keep her eyes open. It doesn't seem to be causing her any pain, but that's what it sounded like to her. And then I also mentioned that we weren't sure about, you know, Ella suffering a seizure a few weeks ago, whether that was a seizure or whether it was just her choking. She believed it was neurological, which made sense, but we wanted to do this other blood work to rule out anything else. So I did get a call from the vets today, and all her organ tests were normal. So they said it could possibly be a tumor in her brain. However, her white blood cell count is normal, so it doesn't indicate any kind of infection. And her kidneys and her liver are both functioning fine as well, which is a big relief. So that means that this is neurological, and basically at this point this just means supportive care for Ella. So it means that you know, watching her closely, helping her when she needs us. So, you know, when she's suffering from a stroke or seizure, just keeping her warm, and looking after her. The nice thing is, because I'm at home, I can constantly monitor her. I am going to start keeping a logbook of when her occurrences happen, what she's been doing that day, how long they happen for, what she ate, to see if there's any kind of link to what's been going on with her, and maybe something in her environment that could be causing it. So our vet also said if we believed that the medication was what helped her last time prevent these symptoms, that, you know, they would prescribe another round for me. But there's also a lot of risk to having an animal on long-term medication. It's very hard on their liver, and you know, can cause other side effects. And since her organs are all strong, I don't really want to risk that at this point, because if hopefully this is just a bad period in her life that she gets through, I don't want to cause other permanent damage that's irreversible by having her on long-term medication. So having a logbook will help me determine whether maybe that's the necessary next step, or if she's okay without any kind of medication. The other thing is, like, when she suffers these strokes, she's not in any kind of pain. She's not squeaking or chirping or, you know, out of control. It just looks like she just can't move, that's all. It just looks like she's not feeling herself. And just to let you guys know, like I keep saying, that there are a lot of risks when you're testing on a bird so small as Ella. Yesterday when I decided to go through with the blood work, which was the next least invasive step to kind of pinpoint what's happening with her system, she actually afterwards she totally relapsed, had another episode where she couldn't move. They had to put her on oxygen for over half an hour and under a heat lamp to help her recover from just taking those few drops of blood. So that's why at this point, you know, there's there's coming to a medical conclusion, and I know that there's necessary tests that you need to do to perform that, but sometimes it's not worth putting your already ill animal at more risk. And I guess that's something that, you know, every pet owner needs to decide. For us, I feel like the blood work was a good step, because now we've pinpointed what it is. We're not sitting here worrying about, you know, whether it's kidney failure, whether it's this, whether it's that, whether it's something that we could be treating and we're not. We're really hoping that we can just provide the proper supportive care for Ella in the meantime, make the right decisions going forward medically for her, and hopefully we still have a nice, long, healthy life with her. She's only 6.5, and these guys have a lifespan of about 30-35 years if, you know, treated right. So we really hope that we still have a lot of years to come with Ella. Thank you everyone for your support, your best wishes, your thoughts, your prayers. I know I've been posting a lot on Instagram and Facebook about Ella and her updates, and I really appreciate everyone who's taken the time to ask about her, to send me their thoughts and their words of comfort right now, because it has been a really stressful month and a half for us. And like I said, unfortunately, it sucks a lot that we can't do more for her, that this isn't something we can just treat and be done with. But at least I know Ella's got a great home in the meantime, and we're doing everything that we can to make her life comfortable for her. Anyways, thanks for watching, guys. Bye!